Welcome back, everybody. Today we're taking a look at another case study, and I'm being joined by my associate.
How you guys doing?
Now, when did taking care of your health stop being basic and start becoming expensive?
It's a difficult question. I would say. I think in my mind, I would have to guess that it's the subject of health has grown so much over the past few years, especially maybe a couple decades as well. But there's also just new research coming out. Each and every week, every month, every year about a new subject: PFAs, microplastics. This is right. This is wrong. What food is healthy? Organic, non-GMO. All this stuff. And I feel like as the health subject has grown, people have just, the expertise or the lack of might have grown as well. That economy has grown as well. So I think that most people want to be healthier, but somewhere along the way, taking care of your health started feeling more expensive.
100% agree. And if we take a look at healthcare systems, they have evolved into treating acute illnesses instead of long term prevention. What do I mean by that? Is the healthcare system wants you to keep coming back, pretty much giving you more hospital bills, more medical bills to take care of, right? That, I believe, is why modern healthcare is starting to become more expensive and why we are addressing it as a luxury.
Yeah, and I think to add on to that, I think you made a great point that they treat the acute illnesses number one because of the fact that they have such an inload of patients that it's just practically impossible for them to spend as much time with each patient to actually strategize a plan for them to do this long-term prevention. So then patients are left to go see private practices, which those doctors have to charge upwards of $300 to $600. So it's just it's a luxury for the people or society, but at the same time, not all society can actually afford that $600 an hour a visit. So I think that from what you said, again, with the health system and whatnot, is completely true. I think if we're going to move on, the insurance reimburses procedures is just not a lifestyle support, as you kind of mentioned on a little bit. Do you want to mention a little bit more about the next topic and the current one?
Right. Like you said, visiting specialists can cost upwards of $300, right? Now, each cost, people may think that, okay, one time thing, $300, get my health right, something that the healthcare system couldn't take care of. Yes, you could have those answers. But at the same time, what really happens is you're just delaying the care, right? And the thing about delaying care is that people will start to normalize feeling off, right? And that's not something that we want to normalize.
Yeah, feeling off is, we don't want to normalize it, but yet it has been normalized. And
100%. And in turn, this kind of builds the mentality where taking care of your health becomes reactive instead of preventative, right? Which is where the healthcare system kind of, has their grasp on, if
Yeah,
that makes
so
sense.
no, no, 100%. I think if we go layer by layer and actually understand how the health system charges people, so we talk about specialist visits, where in which were 300 to $600, on top of nutritionists or therapists, which are again not covered by insurance, and then we go on to getting good whole foods, organic, non-GMO, whatnot. Then we go to the fitness environments and how that can cost more. Being in the right gym or having the right personal trainer. Then we have to get supplements. And then on top of that, we just got to think about the time cost, not all physical cash money. So that time cost with the appointments, the research, with the trial and error, like, is this habit right? Is this habit wrong? That right there is a seven-layer cake, and it's impossible to get through because the fact is, well, let's just take this for example. Why is it such a luxury? It's in its name right there. it is a luxury. Healthcare has become a luxury, and that's why it's super easy for the rich to just have the this system where they can easily.
Right.
I think I'm
And
getting into too much. You go ahead.
right. And not to double speak on what we spoke on last video, but most people, the average citizen doesn't have the time to wait in lines to get an answer that is incomplete and have to come back for another visit and drop even more money on medical bills. Not
It's
everyone has that luxury,
Yeah, and I
right?
think I think to relate to that, you can continue after this, but I think it sucks that if you were to drive down to an emergency room or urgent care or even your doctor, wait for 30 minutes to an hour, be in that visit for 15 minutes, get absolutely jack shit, then have to commute 30 more minutes back home, you just spent almost 2 hours of your life and it has not improved anything. Your symptoms have not improved. They gave you nothing that could have helped you, and on top of that, you've been struggling with this symptom or whatever has been going on for the past couple months.
Exactly.
It's a
And
pain.
that's why we're calling it a luxury because only not only, but it is been designed for people who are able to afford it and who have the time for it. The average citizen, it is a struggle
Yeah, no, 100%. And let's take this in comparison because we were talking about the higher income people versus let's say just anything lower than the higher income people, so middle class and lower. Um, Higher income people can actually pay for the coaching, pay for the special labs, get their labs much earlier, get follow up whenever they want, and then that leaves everyone else, middle class and lower depends on how middle class they are, but it really leaves the lower class that
with episodic care.
yeah, no continuity, no guidance between visits. It's just like and the thing is, there's nothing out there that can solve this problem for the middle class and lower. Now, for sure, if we
And
were
that's
to
just what we're seeing.
no, yeah, but like we were to let's we because we did a research topic. This has nothing to do with the case study, but me and my associate did a research topic on other people out there, other doctors, other influencers, other just people in general about what products they offer, and they offer the product that includes, let's say, following up, giving you that guidance. But guess how much it is? It's a band, 2 bands, 6 bands, three
It's
bands.
expensive.
It's very expensive, and people that work all year for that type of money can't spend that. So then we go back to this topic before how they normalize feeling off and they just delay the care. And then when it gets to so much, they end up paying that 6 bands at an emergency room visit. So it comes down to prevention, 100%. It comes down to prevention. So I think there's a massive gap in between you're fine and you're sick.
I agree. And most people live in that gap, right? Let's just be honest. Most people live in that gap between I'm fine and I'm sick,
Yeah.
right? And there's just yeah, just that's the end of my statement.
Yeah, and I think if long-term health is important, it shouldn't only be accessible to people who can afford private care. So that gap is what we're trying to address. Again, at every video, we always want to state the gap, the hole, whatever you want to say, and that is what we're trying to just understand and like
We are trying to create
bring
emphasis that that
exactly.
gap exists and it is real.
Yes, it is real. And I want to just move back before we finish up real quick. And I just want to understand, or I just want to emphasize, as you said before, that that gap is definitely understood. But on top of that, is that when people do not have access to preventative care, where do they source their information?
Well, we'll have a number of sources in the description, but at the same time, people, well, I mean, personal research most of the time. But what we are building, Evernour, will be a domain for all that research and all that education for people to access.
Yeah, and I think to just add one point onto that, I think when people are lost in where to find their information, they often go to the influencers that they trust. And it could be a really good solution or it could be a very big problem because that influencer, even with their 25 years of experience, might just be trying to make a quick buck off of you. And that comes down to moral and ethical and whatnot, which we will not get into today. But again, yes, very true. There's so many different problems, and there's that big hole, there's that big gap,
That
which
is
is
very real.
that is very real, where the
As
rich,
as normal as it is, as normal as we have made it, it does exist, and it is something that we need to address.
yeah, and I don't think anyone else has addressed that. There's no care for middle class and lower. Number one, because the fact that they realize that let's just be straight up, the healthcare system is completely expensive. And for a middle class person to try to afford like a big long visit with these private practice doctors is just impossible. And to get access to something like that, even for someone to build like a build of actual program where you can get access to it, they would have to make that program just like upcharged like insane. Like still, they would still have to make it $1,000. But it'd be interesting to find out like if we can find a solution to getting cheap care at the same quality, at the highest quality. Be very interesting. But besides that, that ends the case
Our
study today,
discussion?
and
Yes.
I think it was very informational to really just think about why has healthcare become a luxury as of recent.
Mhm.
Do you have anything to add before we end up?
No, it seems you've covered all the bases.
Okay. Well, again, guys, it's been Evernour, and it's been great having you guys. And we'll talk to you guys tomorrow.